assist is FIM level what?
And get it down by her hips.
Good job.
You don't want it too far up, so it will continue to ride up.
With supervision and min assist, she was able to scoot herself forward. Max assist, she's upper body's weak, her lower body's weak, maybe her sitting balance is bad. So I'm gonna have to scoot her forward. I think
So now,
Professor said went over in lab about weight shifting forward. So, and you probably just did it over there. So
take your right leg.
same concept. Did she show you both ways, like leaning forward and
Just the
okay? So you can do that way. That's
well,
fine.
actually take her left or right arm, put it on the
Lean
left.
this way. I'm coming behind her. I usually
out of your way.
put my hand underneath the thigh or issue tuberosity, and then I use my leg
Take your
to
left
push.
hand and put it under her knee.
I'm pushing, and I'm having this hand here so that she doesn't fall off the chair. So I'm doing this, and then I'm going to slide her again,
And now you may have
leaning her
to
this
set
way.
it
So
up.
you're off. You want to lean
Remember,
her off of the leg you're trying to move
keeps your
forward.
good body mechanics. You have to become one with the patient. So the closer you get, unfortunately,
You can do it that way.
but it's a necessity.
The other way that sometimes
Though with her hand under the knee.
Now,
that's fine too.
it's hot.
Any way that you guys can do it safely and comfortable for your body is okay. Like me and Samantha have, me and Professor Tartaglia have a big height difference. So I gave the example to the other group. We have a patient that's a C5 spinal cord injury. When I transfer him, I have to use the sliding board this way. I have to come behind him. Whereas Samantha can transfer him forward like
Then that's
this.
better for you.
Because
Does that make sense?
when I try to do that to him, I'm tall and his throat goes into my shoulder. So he's like, as I'm transferring him that way. So I have to come behind, whereas Samantha's smaller, she can come in front. So depending on your size and the size of the patient is gonna, sometimes you gotta switch up how you're transferring people. I personally feel more comfortable coming in front. But for him, I can't do that, so I gotta go behind. So it's important to know different ways and different techniques. There are some times where I pull the leg like this, you know, but
So I would just change.
sorry. So if she taught you underneath the knee, that's fine too. I usually use, I use my knee. Maybe I'm taller, so that just works better for me to have, I kind of have a good strength, whereas if someone was shorter, their knee may not line up with the patient's knee. So it's all kind of figuring out what works good for you, and that's why you guys gotta practice. Alright, so for max assist, we've weight shifted forward, so you can lean over and use the knee, or you can also come underneath. Same thing. Did she talk about putting underneath the bottom to scoop forward? Okay. So that's sometimes, if someone's not moving, sometimes I'll put my hand underneath their butt and kind of wiggle them
Or
forward.
you can just grab her and
So you
just
can
push
come
her
this
over.
way and do the same thing.
Okay.
Okay. As long as you guys are bending, you're not leaning with your back, and the patient is safe, and you're getting them there, that's all right. So if I were to try and place the sliding board right now, would it work? So I actually scooted her too far forward. I'm going to have you just slide back. All right, so max assist, she can't do much. So I'm going to help lift up her leg and slide her. Yep. So you can lean this on. Okay.
Okay, so you're gonna take your left arm
And I'm leaning her back. So now we have the sliding board underneath the thigh, on an angle.
Oh, wheelchair.
So I'm going to have you, let's see, maybe you can use this arm to help push off the armrest. I want you to position your arm here, and then I'm going to help. So I'm going to lean her forward this way. So I'm gonna, you don't have to do, sorry,
It's okay.
you don't have to do one big swoop. You can, but sometimes I'll do little hops and then have the patient take that moment to reposition their hands, get them to kind of participate with the transfer, okay? So actually I'm going to do it this way. I'm going to lean her off this way so that she's leaning off the side that we're trying to slide to, so that she's not applying weight this way, impacting my ability to slide.
Am I the noodle?
Pull her in.
Okay.
You want to pull her. Yeah, that's the girl. There you go. 2.
Well, is she gonna fall forward?
No, you're there.
I'm right here, right? Is she going anywhere? The other thing I want to point out to you guys is that I'm blocking her knees. That's very important because if you're not blocking her knees, then she very well might fall forward.
Gravity to help you.
And you want to take the time to reposition yourself as you go. You don't want to do a twist where your legs are planted and your back's in a different direction. You want to move along, okay? So I'm coming this way. I'm squeezing her knees with my hands and I'm lifting.
You just have to be cautious of all this stuff. So obviously she
I was like
doesn't,
squeezing her
but
butt.
like how you do stuff. So just know, okay?
Would we be able to, since like
Put a hard face out of her.
hands on the way over, or do you want to really,
You can do underneath the butt or I would do the knee belt over the pants. Sometimes I
to give her own pants?
and give the pants, like that time I did have both my hands underneath her.
You know, and
Try to have like one on the gate belt, one underneath her butt, one underneath her thigh, wherever you guys feel comfortable because everyone is different sizes, different arm lengths, so it's, I don't want to say there's one way, as long as you guys are safe and the patient is safe. So coming back, so that time I had her leaning forward, so this time I'm going to help clean her. So she doesn't have an arm support here, so I want to make sure I don't just like lean her over and let her fall. Okay, so I'm going to have her lean into me. I'm using, and use your legs when you can. I can use my leg to lift up her leg, so I have my arm free to place the board. I'm going to have you
you would have to have somebody hold it. Because it
So-
would be too unsafe, and then you'd have to
So
have
let's
it
say this
down.
time I'm just, let's pretend I'm much shorter,
It's
and I'm
completely
going to have you
unsafe.
put your hands here, and you're going to help push off here. So she's helping push, so she's doing 25% of the work. And I'm going to come super low, and now I'm in front of her instead of like this, like I just was. And I have my hands on her gate belt and one on the pants. 1, 2,
So we're gonna move
and I'm squeezing her legs. 1, 2, 3. Good. And did you see how I moved my body with her?